warm greetings to one and all. This is Dr. Anita Sargent, your MC for the day. Let's wait for a couple of minutes for the rest of them to join the session. Once again, welcome back to the free online session of online dentistry. Online dentistry has been the pioneer in providing dental education via both online and offline platforms. Ever since the breakdown of the pandemic, COVID-19, it started to support millions of students across the globe through online sessions. We are sure that our students have benefited very much from these sessions. Until date, they enjoy the privilege of attending the course. It has been over 14 years that online dentistry have been conducting sessions for clinical practitioners across the globe. We also provide access to the recording of our sessions 15 days post the session. Post-COVID-19, online dentistry have been conducting offline sessions in various cities like Delhi, Pune, Hyderabad, reaching to umpty of clinical practitioners who have benefited greatly after attending our sessions. So in response to the unending request for online sessions, we have come up again with a free online session. So like our last session, once again reminding y'all, our free sessions will be available on every second and fourth Wednesday of the month. So mark your calendar for these days at 9 p.m. So I think without further ado, let me hand over the session to the academic head of online dentistry, Professor Dr. Joby Peter, to introduce the speaker for the day, Dr. Binu T. Abraham, CEO of online dentistry. Have a great day, guys.
Thank you, Dr. Anita, and welcome one and all again to this online session by online dentistry. So as our name suggests, online dentistry is always online. That is the thought of all the people who have attended the program, but we were never online until we started the lockdown webinars there. So it was just a name that we coined, online dentistry there. And I'm so happy, proud, and privileged to welcome you all at 9 p.m. every second and fourth Wednesday. Free sessions, various speakers who have proved themselves in the field of dentistry to share their knowledge with you all, and welcome and mark these timings. Indian Standard Time, 9 p.m. on every second and fourth Wednesday. So our motto of online dentistry is to redefine dental education, but the best way we could do it. And we have offline and online sessions there. We have a lot of support from international and national faculties, students, postgraduates, practitioners across the globe. And thank you so much for your support for us. We have around 10 centers in India, in national India, across India, 10 centers where we go and do offline classes. And thanks to all coordinators of the 10 centers who work relentlessly and support us with our offline classes. And to let you know that we are going international, so proud and privileged to let you know that we are going into Dubai. We already conducted one batch in Dubai, a DHA approved program in Dubai, and we are again coming back in Jan 2023. Mark these days, and February 26 and 27, we have offline program in Dubai related to interceptive myofunctional, clear aligners. So many things are happening there. So you can get all the details updated in our website there. And a big announcement for this point of time that is we are extending down into the most beautiful continent of the entire world, the South Africa. So we are going into South Africa. We have been invited as guest speakers in South Africa, and we will be soon coming into South Africa. Please do support us Please do meet. We have so many people support us from South African continent, the beautiful continent, the entire world, you can say. So July 2022, we are for a 2 or 3 day program on offline program in South Africa. Please do support us. Happy to see you there. Our one of the trademark program after this 14 years of into teaching and preaching is 1 year program, which is been well accepted. We had to do a second batch of this 2023 2022 because of the demand, so that is also full now, and one more batch is coming up in September. This batch is almost full, and another batch of 1 year program is coming in September. And this is a program where you will be given patients and you will be doing cases, and an amazing program of interceptive myofunctional in Anur Dental College, where I am working as a professor head of the department. So I welcome you to my department. You will be posted there. You will be seeing cases, analyzing cases. All your doubts and worries about interceptive myofunctional will be completely covered there in a 1 year program where you have 12 days of offline and followed by multiple online modules and post-course mentorship, and all those things will be given to you. Then short-term courses, as we were started with short-term courses. So we are continuing with the short-term offline courses. And in Chennai, we have a 3-day rigorous 8 to 10 hours of rigorous training of 3 days, 10, 11, 12 in Chennai. That is India. That is the capital of Tamil Nadu. There we will be having a 3-day intense training, and booking is going on there. So guys, note down this timing, online dentistry at 9 p.m. Do not miss that. If you have any doubt and queries, please log on to www.onlinedentistry.in. You get all the information that you want there. And we are giving you a personal numbers, WhatsApp numbers, so you can contact us or put a message. We will reply back within 24 hours of the duty time. So you will be informed with all the queries and your doubts you have. So guys, today I am so pleased and happy to welcome my own best friend, partner, the person who is behind the online dentistry from the inception itself, the beginner, Dr. Binu Abraham. And one of the must attend or must practical tips that he can give you is dental photography. Now, to talk about Dr. Binu, he is my friend, my brother, my very close person. We associate every week. We see, we sit, we discuss, because I am his pediatric consultant for the past 14 years. And we still continue the friendship, brotherhood for a long period of time. He is a person whom all you should meet one point of time of your life. You are coming to Kerala because of his way of explaining things, understanding your profession, and dedication to the profession, commitment to the profession. Is a person apart from any of the people who you can meet. He finished his BDS in 1996 from MCOTS Manipal, and went on to do his postgraduate degree from New York University, USA, where he was offered a job to work because of his skills, but he came back because of the commitment. And he started one of the state-of-art clinic in a small rural area at that point of time, and you should visit his fraternity and the entire setup that he has got. That is an amazing thing to know. In a rural area, you can have a setup like this. That is amazing. His passion towards the dentistry, towards his profession, towards his colleague, family, friends, neighbors, that is amazing to see. So without much, he is very sought after speaker, national, international, you name it, IDA, ISPPD, IAPD, you name it, he is a sought after speaker. So you are lucky, privileged, and honored to hear from him. And today's topic is so relevant. Hands off to all of your support that you have given to you. I welcome the star of the day, Dr. Binu Abraham. Over to you, Dr. Binu.
Thank you so much, Dr. Jabi. For a second, I was thinking, are you actually talking about me? Thank you very much. And thanks for the overwhelming support shown to online dentistry programs. Thanks to all those people who are listening to me and all those people who are in video. Amazing response. Dr. Joe, a technical team, whoever is there, is my slide shared and clear? Can you please confirm that?
Yes, sir, your screen share is working, but if you could move into the full screen mode, perfect, sir. You're all set to go.
Anybody ready to come in video, please do so, because I hate talking to computers. But it's okay. Multiple places, multiple timings. I know it's like 1 a.m. in some countries. Somebody was just messaging that it's like 1 a.m. And other countries it's like real late at night. Those who can come in video, please do that. We can have a good session. I can see some people, it will be nice to talk to. Yeah, Dr. Ashley, thank you so much. Divya Chandran, thank you so much for coming in video. Okay, so this is the typical starting slide. I always put Dr. Natasha is here. Thank you so much. Typical starting slide I put. Let's all take a picture with an f-stop of 2.5, shutter speed of 1/60, with a white balance in auto and ISO in 6000. Wow, great, no? See, this is what happens when we go to a photography class. I have gone to multiple photography classes. Myself and Dr. Joby have traveled abroad to learn photography. And this is what happens. They talk big stuff here. Big stuff, as if we know everything. Dr. Ritu, my God, the couple, a senior couple from Jammu is listening, from Jammu Kashmir. Wow, great. Okay, so let me keep it very simple here. My policy today is keep it simple. And I am not going to go into hi-fi stuff. So those people, especially Dr. Ritu Ahal, I know they have all the big time digital SLRs and all in their hand. Guys, this is going to be a disappointment. This class is going to be a disappointment. I'm not going into that range. I'm going to do pure basics of why photography. Why photography? Patient walking into a clinic with a complaint of a huge diastema. Sir, can you do something about it? Now, you immediately take out a piece of paper, you start drawing two teeth, you start shading, you add composite. This is how I fill up the gap. The immediate question from the patient, how much it will cost? Is there any guarantee? All sorts of questions will come up. Instead, why don't you put that patient's picture on a big screen and show it like this? Guys, the immediate response from the patient is, oh my God, this is this big. I didn't know it is this big a gap. It was a casual inquiry. It was a casual inquiry. Now they are serious about it. Now the ball is in your court. Do whatever you want. Do Photoshop or show your previous cases. Previous cases. You have 10 diastemas recorded in your clinic. Guys, how many types of diastema can you see in dentistry? So record 10 types. There's nothing more than that in dentistry. And show them how you treated it. Please don't show them pictures from Google and all that. Try to show your own picture. Let them relate. I always show the full face. Let them relate to their own close relate. Oh my God, this is my cousin. He comes to your clinic. I didn't know that. Let them relate. Yeah. Showing from Google is very easy. That casual inquiry about the diastema slowly became a necessity. Their question is never ever, what is the guarantee? How much it will cost? And there's one irritating question I get from patients many times. Doctor, then if you want, you do it, doctor. If I want it, I don't want. I don't want. My this month's EMI is completely covered. My car EMI is covered. I don't want. If you want it, better do it. I hate that typical dialogue from patients. Oh, root canal. If you want root canal, you do root canal. I don't want root canal. If you want, you do it. Casual inquiry becoming a necessity is what I'm trying to cover here. So, why photography in dental clinic? I actually covered a huge topic of our one-day photography class. Why photography? And the number one in the list of why photography, I would say, is practice management. At least in India, it is practice management. But anybody else listening to me from other countries, it may not be practice management. It can be records management, insurance management, legal issue management. There are a lot of other things, but in India, at least, it's still practice management, the reason why you take pictures. So, practice management, primary reason for taking pictures. And now, let me go quickly. I don't have much time. Quickly into gadgets. Which gadget to use? Everybody else, sir, I have a 1.5 lakh digital SLR with me, but sir, I don't know how to use, sir. Can you please help me on that? Heard all that. The purpose of this lecture is not to make you spend any money. End of this 45 minutes, I guarantee you, you will not have to spend any much money. I will not be explaining about costly gadgets here. Let's start off with your mobile. You already have it? No. Start off with your mobile. At least take pictures with mobile. That is my point. At least take pictures with mobile. See, there is something called a picture, a good picture, and an excellent picture. Start taking pictures. Start taking pictures. Later on, find out how to take good pictures and then excellent pictures. Do not try to start from excellent pictures. Why? Not needed. You take excellent pictures when you go with your wife for honeymoon or whatever, but dentistry, start off with basics. That's all I'm trying to tell you here. Incorporating photography into your daily practice, primarily divided into extraoral view and intraoral view. Extraoral view and intraoral view. Guys, just one disclaimer here. If you are very adamant that you will use only a mobile phone in your clinic, I have no plan to buy a digital SLR. Just a small disclaimer. See, this mobile phone photography, it's fine, yeah. With the phone I have, the topmost iPhone 14 Pro. You see, it's a beautiful camera, no doubt about it. But that's not the point I'm trying to cover here. The point I'm trying to cover here is something called professionalism. Please don't be surprised if patients ask you on face, doctor, why are you taking the picture of my daughter in your mobile phone like this? Please don't be surprised. You will get those things soon. So people are watching. They are looking at all this. They may not like, I mean, I would like somebody taking my daughter's picture, my daughter who is at 18 years at this point of time, keep on taking pictures with a mobile phone like this. I may not be very happy. Now, forget taking. While taking, while taking, I can hear a notification. And this doctor looks at the WhatsApp and smiles for some time and now come to photo again. Come on, that's not professional. So if you really want to take picture with your mobile phone, these are the points I want to tell you. Please put it in airplane mode. Do not look at your WhatsApp in between. Number one. Number two, do not show the patient directly on the phone like this. See, look at this, look at this, look at this. And that fourth swipe can be an auto download from a WhatsApp. God knows what it is. Be professional, guys. That's what I want to have a disclaimer regarding this mobile. Otherwise, mobile photography is no bad. Let me tell you, my mobile phone at this point of time is having a much, much better sensor than my existing DSLR. So mobile photography is definitely gone way up. But look at that professional part also. Let's quickly come to type of photos, extraoral and intraoral. These are the only two types you'll take, no? Extraoral and intraoral. Let's talk about extraoral. Extraoral, mainly the profile picture, the frontal. In the frontal, you're talking about the smiling, non-smiling, angled, contra-angled. There are many types here. But to convey the matter, all you need is a nice, good frontal. Smiling and a non-smiling will normally take care of it. Now, when it comes to this frontal, what are the things to look at? That's what I'm trying to come to. Please, one thing I'm requesting you, have a plain background. That's all. Simple, plain background. Now, try to take as straight to the patient as possible. Not like this, not like this, as straight as possible. Let me now come to some troubleshooting. This whole lecture is actually troubleshooting. That is, bad pictures taken by our own people with their permission. I have posted it. With their permission, I have posted in this particular lecture. So, these are typical frontal picture smiling, and then I take after. When it comes to after, I always have this habit of taking the after and the greenery if possible. If you have a greenery, go ahead and do that, because the before after can be given as a souvenir to them. All my orthodontic patients and even smile creation patients get a souvenir before after. They treasure it, guys. They'll keep it in that show wall or whatever of their house. Any guests that come in will see that. Oh my God, this is how you were before. And then bottom line, they'll see the clinic name and the website address or the phone number. Let me come to troubleshooting directly. These are the profile pictures or the frontal pictures given to us in our groups. We have more than 150 groups with discussions of multiple cases going on. So this is supposed to be a frontal picture given by one of our candidates. With her permission, I am posting it here. This is supposed to be a frontal picture. Nice Venetian blinds behind and nice wooden work, no? Very nice. Now, who is bothered about that? If you're looking at stuff, let it be a plain background. Wow. Look at the bangle of that assistant. Nice, no? So that doctor hasn't even taken that effort of asking the patient to just come out of the dental chair and stand in front of a wall. That's all I'm asking. That frontal is supposed to be taken right on the dental chair. No. Extraoral pictures are not to be taken on the dental chair. Now you check Indian journals and international journals, you can understand the difference I'm talking about. Profile. Profile is so very important when it comes to orthodontic diagnosis and even cosmetic diagnosis. It's very, very important. So, Profile, the biggest hassle is a shadow. You'll get a big shadow. How to avoid a shadow? To avoid a shadow, the easiest method to avoid a shadow is to avoid a flash. If there's no flash, no shadow. But if there is no flash, there may not be enough light. So all you have to do is in that particular room where you are asking your patient to come and stand, have a 650 watt CFL or LED ready, switch it on only for this purpose, it serves. But if you really want to have flash, there are some tips I can give you. One, ask the patient to stand in front, little more forward of the wall, not close to the wall. One. Two, let the wall be having a cloth or something that absorbs light, not reflects light, like the glazed tiles and the vitrified tiles and all that. It will reflect light. Yeah? Something that absorbs light, a plain cloth is good enough. So little bit of effort is all I am telling you. And to get a cloth, 1 meter cloth background, am I talking about a big investment here? No, right? So if you do not have a shadow, this is the advantage. You get beautiful picture for that nasolabial angle, mendolabal, sulcus, you name it. You can do all that without a shadow. Now come to troubleshooting again. Let's see some pictures. Look at that. This profile picture, if you look carefully, it's beautifully taken. But that grandfather has no role there. I mean, it should be a plain background. That's all I'm telling you. The profile, the looking straight, the angle wise, everything is perfect. But look at who is standing behind. This is another, this client, this doctor, my very close friend, he told me this picture was taken with a DSLR. Now I'm coming to the point which I started off with. Why do you need a DSLR if you do not know this basic which I'm telling you? This is taken with a DSLR. It's a beautiful profile picture, but that background is not good for a profile picture. Nice compressor, no? Wow. Must be at least 1.5 ton compressor. I don't know the power of the... Who are we looking at? What are we talking about? Let's come to the point. Who wants to see that compressor? So take that little effort to get the patient out to a plain wall and take a picture. Now coming to intraoral. Intraorals are even tougher. Intraorals are divided into two, retracted view and retracted mirror view. Becoming tougher. Online dentistry at 9 p.m. Everybody thought it's going to be a very simple session. Now you're talking about big things, Dr. Binu. Not a big thing. A retracted view means you just put a cheek retractor in. That's called a retractor view. A retractor mirror view is what you put a cheek retractor as well as a mirror. That's all. So that's a cheek retractor. Put a cheek retractor in and take a picture. This is what you get. How to take it? Yeah. Not very easy. Ideally, you should have a double retractor, not that single retractor which you use for your composites or your lasers or your orthodontic bracketing and all that. Double retractor. Retract from both sides with the staff retracting nicely, and right from the top, you should be taking. You get good pictures. Let's now look at troubleshooting again. Look at these pictures. Look at these pictures and tell me what's going on. This picture was taken by, again, my good friend with a digital SLR. I am reinforcing the statement which I told in the beginning. Even if you have the top Mach 1, sorry, the Mark 1 digital SLR, doesn't matter if this is how you retract and if this is how you take a picture. How is this? Nice. But can you see my arrow here? Those who are in video, at least just show me a thumbs up. Can you see my arrow here? Yeah, look at that dark area there. Why is it so dark? Light. Not enough light going in. Another one. Again, arrow here. Look at that dark areas. Forget the dark area. I want to tell two more comments about this picture. These orange, red, blue cheek retractors will not work on a proper professional photography. You need a clear, transparent cheek retractor, period. Number two, you need a cheek retractor exclusively for your photography purposes. If you look carefully, I can actually see, there's my arrow. I can actually see composites and all here. So do not use the same cheek retractor for your other works, for your photography work. Should have a separate cheek retractor. And that separate cheek retractor is like 100 rupees, yeah. Transparent cheek retractor, 100 rupees. How much money am I talking about spending? I told about a background cloth, which will be 1 meter background cloth, can be maybe 400 rupees if you buy the thickest possible cloth, 400 rupees. Now 100 rupees for a retracted mirror, for a retractor. Am I talking big stuff here? Dr. Joby was explaining that I was in New York and all that. That was 26 years before, yeah. 26 years, I am in Alua, Kerala, okay? I'm not talking about America here. This is basics, what I'm trying to cover. Now coming to retracted mirror view. You need a cheek retractor as well as a mirror. That's a little tougher. That needs some skill. You need some hands-on to understand that better. Let's look at some troubleshooting picture. Look at the picture. These are the pictures we get in our group. Sir, please tell the treatment plan. We hear all that. We see all that. Which is fine. We still give the treatment plan. But the purpose of this lecture is to make you understand that that's not the way to take pictures. One cheek retractor, one mirror. That cheek retractor, 100 rupees. And a mirror, the cheapest mirror you can get, I would say, is a stainless steel mirror for 300 rupees. I can send you the link. Dr. Joe, end of this lecture, just remind me, all the links of all these mirrors, cheek retractors can be given in our website. I haven't done that yet, but we will do that. My promise. So, mirror. 300 rupees, 400 rupees, steel mirror. That's what we are talking about. Take pictures professionally that looks good, that can be shared out. This is another one. The mirror has scratch. It's taken with a mirror, but mirror has scratch. So you need a scratch-free mirror, I would say. Scratch-free mirror? Real scratch-free, fog-free mirrors are actually very costly. But you can get this 300, 400 thing and use it carefully. It will not scratch. Carefully. Carefully means after each thing, use a microfiber cloth, cover it nicely and autoclave it. Nothing will happen. But you can't just take the mirror and throw it onto your granite table and all that. It will scratch. So take good care of your mirror. It works fine. Another thing I want to introduce here is about a celebrity sitting in front of me, talking about incisal edge contouring, veneering, or smile creation, all that. You talk about big stuff about smile creation on her central lateral, whatever. Talk big things. After hearing all that, she asks you, doctor, is this white spot cancer? I read in a magazine that these white spots can be a cancer spot. So where are they? What you are talking, what they are understanding is completely different. So if you're talking about anterior cosmetic treatment, be specific. Use something called as a contraster, a small, simple black plate, another maybe 700 rupees. So till now, how many rupees I have asked you to spend? Cloth 400 rupees, 300 rupees, cheek retard 100 rupees, mirror 300 rupees, and now 700 rupees for a contraster. Have a contraster, put that inside and take a picture like that. Now talk about the incisal edge. Now come to the point. Marketing, guys, how you convey what you wanted to convey. Now they are not going to look at any white mark here and there. Come to the point. Isn't that definitely better than this? Tell me. And how much you have to spend to get a picture like this? 700 rupees on a contraster. The link to the contraster I will send you after this lecture. Now, shade. Shade is a very, very tough topic. It takes me at least 1 hour to 1.5 hours to cover shade selection using photography in the prosthodontic department, using gray card and all that. It's not easy. But let me tell you one thing here. Simplest thing you do is take a picture of your patient's the crown cutting done or whatever, but put couple of your shade guides also in there and take a picture. That will give a good idea to the lab guys, what are you talking about? But this is not the way to go. For shade selection, for proper shade selection, we are talking about gray card. We are talking about screen optimization, not your screen. Your screen has to be optimized. Your lab fellow screen has to be optimized. It's not easy for proper shade selection using gray card. But at least take a picture with your multiple A2, A3, B2, B3 and all that in there. They get a rough idea what you're talking about. And the biggest problem we face these days is you take a picture and send it to the lab through WhatsApp. Oh my God, that's such a worst medium to send an image. It just compresses the image so badly that you will not reach anywhere. So color selection, white balancing. I have an example here. This is a picture of a flower, beautiful flower. Look at the left and the right. You're talking about white balancing difference. The white has been balanced differently on the left and the right. Now, how will the lab guy decide the shade of the teeth? So shade selection is a different ball game altogether. I cannot cover it here, but we have a 1 full day hands-on program covering all that. We'll come to that later. Surgical photos. Wow. Any oral surgeons listening to me? I think I have Pravish here, right? Pravish. Any oral surgeon listening to me? Is that oral surgeon Pravish listening to me? Put a thumbs up. No. Not oral surgeon Pravish. Show me like that, Pravish. No, it's not oral surgeon Pravish. Somebody else? Yes, he showed a thumbs up. If an oral surgeon is listening to me, take your oral surgery journals. Prove me if I am wrong. Oral surgery journal, Indian journals. Yeah, Indian journals. I have seen big cyst being removed, tumor being removed, but the picture looks like blood all over. It's like a murder scene. Preparation for a picture. That's what I'm talking about here. Preparation. So, of course, I'm an orthodontist, so I talk about orthodontic stuff. So this is an orthodontist, the oral surgeon exposing the canine for me to put brackets for me. But when you want to take a picture of a surgeon exposing a canine and putting a bracket, guys, don't do it like wedding photography while the surgeon is doing like this YouTube take wedding photography. No, tell the surgeon, I need a picture at this point. The surgeon will have to wear a new gloves. Prepare the field. with no blood and then shoot. Surgeon has to be ready for that. You can't do like wedding photography. Please. Photograph on an X-ray. Why do you want to take a photograph on X-ray? I don't know. I think I should remove these slides from my lecture altogether. But still, you never know. I still get patients coming in from other countries with film X-ray. But I would like to digitize it and put it into my software so you can put that X-ray onto an X-ray viewer. X-ray viewer will be throwing light, and it should be preferably a dark room. I mean, switch off all the lights in the room and take the picture of the X-ray, whether it's a CEF or an OPG or an IOPA. IOPA. Before I got RVG, this was how I was showing my patients all these IOPA close-ups and all that. So you need better light from behind when it comes to X-rays, and the room should be dark. I mean, switch off all the lights. Photograph of the cast. How to take the photograph of the cast? When you take a photograph of the cast, if you really want to take the photograph of the cast, preferably have the cast poured in white POP, not that red and yellow and the green POPs which you get, the stone which you get. If you really want to take a picture, best is a black background and a white POP gives good images. And you can even buy, okay, these are the pictures our candidates send us. Sir, look at the class 2 molar relationship. Look at the central incisor relationship. How will you treat? We see all these pictures. Nice finger ring. Nice finger ring, no? When did you get married? See, who is bothered about all that? We are talking about stuff. We're talking about professional stuff. You know what? All you have to invest is a small little gadget, which is 999 rupees, I think. I'll send you the link. This is called tabletop photography. Guys, please understand, I am covering complete photography from extraoral, intraoral, tabletop, X-ray, surgical, cast, portrait, celebrity shoot, covering everything in 45 minutes. So this is tabletop photography. You get a small gadget for like 1,000 rupees, a gadget like this. I wanted to actually keep it here so that I can show you, but it's very difficult on a live platform like this to take the camera and show like that. But in our hands-on program, we have all this. People take pictures. So put the cast inside that. And this is the kind of picture you get. A small little 1,000 rupee gadget. Put that in there. The light is from the top. Camera can be from the side or the top. You can get beautiful picture. Let me go back here. See, I don't know whether you can appreciate well. There is a small hole here, opening here, where you can take the picture from the top or picture from the side. So all sorts of things available online. I'll send you the link. 1,000 rupees. So how much money have you spent altogether? You thought it's a free program. Now you already spent almost 1,500 rupees. Believe me, it's worth it. And once you have the tabletop thing, guys, your wife makes a good chicken dish, put that under that, take a picture. That's the way to go when you have when you want to take a nice food picture. So tabletop photography is for jewelry photography, food photography. We are talking about all sorts of branches of photography here, guys. But let me come back to dentistry again. So another thing I want to tell you, this red lines, I'm sure many might have seen in your camera. These lines, when you try to take a picture, you see these grids. What are these grids? These grids are automatically given by the camera, helping you to compose the picture. This is picture composition. How to compose a picture. Now, let's look at this particular tower, the lighthouse. This lighthouse looks good and nice. Okay. What I'm trying to cover here is something called as rule of third. Rule of third in general photography. Rule of third in general photography says that your subject should be always kept at one of the thirds, not in the middle, one of the thirds. That gives a different value altogether to your picture. I don't know whether you can appreciate the top picture and the bottom picture has a different value altogether. This is rule of third. You put your subject on one of the thirds. Look at this. This picture got a life when that subject is on that third. If the subject was in the middle of the picture, it won't have that value. Now you look at any picture, any celebrity picture, any film poster, you take any picture on any good magazine, you will understand what I'm talking about. Something called as a rule of third in photography, where you always keep the subject towards one of the thirds, not in the middle like that. It won't look good. I'm not talking about dental photography here, because I had promised in the poster in that online dentistry at 9 p.m. poster, which you might have got, there was a line saying that general photography also will be covered. So this is part of general photography. Don't keep your patient on one side and all that. Yeah, this is general photography. This is outdoor photography I'm talking about on the rule of third. Now, for those people who wanted to come in to know about digital SLR, I don't want to disappoint them. I told you in the beginning, this lecture is not for those people who have big stuff. This is for those basic stuff. Start taking picture. Picture, good picture, excellent picture. Let's start. Now, those who really want to know about digital SLR, all I want to tell you is, when you buy a digital SLR, you get a lens like this. When you buy a digital SLR, the body is what matters, not the lens. The lens which you get will be an 1855 focal length free. Sir, it's an offer, sir, Christmas offer. With the body, you get a free lens, 1855. It's a worthless lens for your dental photography. You cannot take good pictures with an 1855 lens like that. You better buy a body and do not get that. It won't help you in dental photography. For dental photography, you have to invest on a macro lens. Macro lens. 100 mm macro lens, write it down. 100 mm macro lens is what you need when it comes to dental photography. No 1855s and all that free lenses that you get when you buy the body will not work. It will work here and there, but let me tell you, your mobiles can take better pictures. So think about, if you're buying a digital SLR, think in terms of a 100 mm macro lens. Then the light. Guys, again, I'm stressing on the topic, light matters. When it comes to light, you need a ring flash or a twin flash for a better photography with digital SLR. Then you might be thinking, in mobile, how will you do with all this? In mobile also, there are mobile attachments, ring flashes available. Mobile attachment ring flashes are available. I'll send you the link. But again, light quality is not that great. See, the biggest problem when you use the mobile is when you take a picture, the camera or the flash will be going in a different direction. Your mouth will be in a different direction. So that's the biggest problem. Your flash is going straight, your mouth is down there. So this is the biggest problem we face. Light. get better light. Worst comes to worst, use the chair light. But the chair light is like, normally chair lights are warm light. So if you want to have a white LED light for your, there are many new chairs coming with white LED lights, which are a little too bright, but it works. You can give a try with that also. Light matters. Then again, for those people who are photographic experts listening to me, what is Dr. Binu talking about? We came here thinking that he will talk about aperture, shutter speed, and ISO and all that. This is aperture. Aperture is nothing but your pupil of the eye, how much you open the pupil, depending upon how much light you have in there. So when the aperture is very less, the light going in is very less. Increase the aperture. As you increase the aperture, you can see light going in is much, much better. The picture down there, you can see the aperture is so big that the light is too much, and it's in photographic term called as a burned out image. That's too bright. So adjust the aperture, you can get your light adjusted. All that possible only with a digital SLR. Mind you, mobile phones do not have that much of a setting possibility. The aperture, the exposure time, setting possibility is very less. Even if it's there, it's all digital. It's not really optical. So we are talking about optical physics phenomenon and digital Tim Cook phenomenon here. So iPhones or whatever phone you're talking about, we are all talking about digital era. Light matters, guys. Light matters. But those who still want to do digital SLR, let me tell you, digital SLR is the way to go. That is the type of camera you need for your best picture. Those who really have a digital SLR in your hand, all I want to tell you here, the last slide is for the digital SLR people. This slide is for the digital SLR people. Because I know you didn't get anything in this lecture. Last 40 minutes, you didn't get 35 minutes, you didn't get anything in this lecture. Because I never talked about digital SLR. So this one slide is for you people who have a digital SLR in hand, but do not know how to use it. Guys, put that in manual mode. Never, ever put it in auto mode. Photography is the only place we say, do not go green. Everywhere else is go green. See, you look at the auto, it will be a green square in almost all the DSLRs. Never go green. Everywhere else, go green. Photography, never go green. Put in manual mode. Then put your f-stop, the aperture, to 16. And put your exposure to 1/200. How to put it into 1/200? That doesn't come in the scope of this lecture. Which is your camera, I can guide you on how to literally change your values. But put your aperture in 16, put your exposure in 1/200, you get good pictures. Believe me, you get good pictures. That's all you have to do. Little bit of aperture change here and there, depending upon whether it's extraoral or intraoral, little bit of aperture change. Or you want to go real close up into the root canal anatomy of the root canal orifice and all that, the aperture might have to be changed a little bit more here and there. But basic photography, these values, put it in manual mode, put the aperture to 16 and put your exposure to 1/200, you get almost all good pictures there. Let me conclude. What did I cover? Importance of photography. Most commonly taken views, gadgets used, and tips for SLR users. That's only one last slide for SLR users. What did I miss in this program? In this program, I think what I missed is big misses, like how to transfer to the computer quickly and efficiently, how to edit the picture quickly and efficiently, how to back it up, how to retrieve at the right time, and how to cloud backup, and hands-on photography. I missed all that. I know I missed all that, but those who are really interested, we have one full day photography program covering everything. 1 month before the program, candidates will be added and closed and ready in the group. And they will be asked to send the pictures they are taking at this point of time. And they will be asked to tell what all gadgets they have at this point of time. And they will have to bring all the gadgets they have at this point of time, hands-on, on how to take each and every picture I just now talked, so that you get to improvise on every picture taking. Without hands-on photography, you know what? It's like learning swimming online. Thank you very much, guys. Thanks a lot for the support given to online dentistry programs. Please, as Dr. Joby said, visit us in Kochi, Kerala. Please, if you're coming towards the southernmost tip of Kerala called Kochi, let us know. We will have a good time here. Thank you very much. I'm open for questions at this point of time, open to the coordinators. Thank you.
Thank you, Binu sir. It was indeed a mind-blowing session. So let's all wait for the next session. It will be on the 2nd and 4th of every Wednesday. Stay tuned by then. See you.
Wait, if they have any questions, just go to the chat box and see whether they have any questions. I haven't gone to the chat box. Yeah, Dr. Anita, please give them some time if they have any questions in the chat box. Otherwise, it's okay. If there are no questions, that means two things. They understood nothing or they understood everything. I don't know. So I'm leaving it to them. But I don't have the chat box in front of me. Dr. Anita, please make sure.
Yes, I'm checking.
Please make sure there's no unanswered questions. That's not nice.
Yes, sir. We've got many thanks, sir. Yeah, sir. Sir, Dr. Ashok Raj have come up with a question. We are facing some problems while taking surgical photos of posterior area. After placing a cheek retractor and a mirror, we have put one more instrument to retract the flap.
Okay. 1 second.
It seems they're facing problem while taking surgical photos of posterior areas, sir.
Yeah, I just got the chat in front of me. Okay, this is making sense. Dr. Ashok Raj, I'm assuming he's an oral surgeon. So we are facing some problems while taking surgical photos of posterior area. After placing a cheek retractor and a mirror, we have to put one more instrument to retract the flap. Fine, that everything makes sense. So what is the problem? So what is the gadget which you're using? Which is the lens you are using? Ashok Raj, you want to come on video or audio? We can talk. Or come to me personally. We can discuss. Okay. But I think you're doing a good job by having a cheek retractor and a mirror. But now your problem is you need one more instrument to retract the flap. So looks like you are talking about how to go closer. How to go closer. Ashok Raj just says that he's not allowed by the host to unmute. So you want to just allow him to unmute. Please do that. Technical team, please do that. Let him talk. Okay, those who are already bored, I'm done. Okay. I'm here for answering these questions. So don't say that, oh, this fellow Binu came in at 9 and now it's already 10 and he still hasn't stopped. I have stopped. I'm done. Okay. But
Hello,
I'm
sir.
trying to answer the questions here. Dr. Ashok, are you here?
Hello, sir. Hello, sir.
Yes.
Can you hear me?
Please, I can hear you. Go ahead.
Sir, when after placing a cheek retractor and a mirror, suppose we are doing a maxillary 7 region on buccal aspect.
Oh.
So we are placing a cheek retractor first, then we are placing a mirror on the buccal vestibule. Then we have to the flap will be. I am a periodontist. If we are doing a flap surgery, the flap will be covering the bone defect. So we have to retract the flap with a periosteal elevator or something to see the bone defect. So while we can take preoperative picture, postoperative picture with a mirror and cheek retractor, but while inserting an additional instrument to retract the flap like a periosteal elevator or something, that instrument or our hand will obstruct the view of the to take the picture. It is difficult. Is there any technique to counteract this?
Which is the camera you're using?
We usually take with mobile phones, but I have I am also using Nikon 7500 also. I use occasionally, but most of the time I
lens of the Nikon 7500.
It's I have two lens, but usually with the 18140 at 100 mm, 100 mm. At 100 mm,
it should be 100 mm macro. It won't work. It won't work without a macro. You're talking about too close a field. You're talking about too close a field. You have two options. One, invest on a 100 mm macro, which is like 50,000 rupees, or invest on a intraoral camera, IOC. You know what? IOC works better. 4,000 rupees, 5,000 rupees intraoral camera, you might.
Sir, what is the difference between 100 mm macro lens and another lens which is zoomed to 100 mm?
No, zoom to 100 mm is you're just optically or digitally zooming. That's
not
all.
Optical. Yeah, optically zoom.
Or digital. But macro means you are letting
only
camera
image quality.
No, not image quality. Macro means you are letting the camera to come close to the subject. The other one, you can't come close to the subject. How much close you can come to the subject? If this is the subject and this is the camera, 100 mm normal lens, you can focus only at this distance. 100 mm macro, you can focus this close. This
but
close.
We are not able to put the camera that close while inserting the three things: retractor, mirror, and an additional instrument, and our hand also come in the way.
Why not? Camera can still come close. The lens can still come close. The lens can still come close to the subject. But see, are we talking about one person doing everything? No, right? I am sure you have assistants and all that.
We have assistants, but sir, when we are using mobiles, we are trying to take as close as possible. But while coming too close,
in your situation, let's not even talk about mobile. It's not going to work. Period. It's not going to work.
Okay.
Mobile, whichever mobile you have, it is not going to work. Maybe the latest, the 13 Pro and the 14 Pro has a macro feature. You come close, it focuses little better, but nothing like a 100 mm or 105 mm macro lens of a digital SLR. So what you are talking about is little on a hi-fi. Okay, you know what? I think you should come to me personally. Let's not waste the time of others. We are talking about next level.
Yeah, I asked this question just to know that.
Questions. This is next level.
Yeah, I was asking this question to just to know that is there any other instrument or something to retract the flap without obstructing the field?
The instrument, there are many instruments, but the point here is how close can you get your lens to the subject? That's it. Instrument, there are many instruments. Exclusively photographic retractor instruments are there. But how close can you come? The point here is, what is your gadget? How close can you come to the subject is the only topic we need to talk here. And let me tell you, your intraoral camera of 4,000 rupee will work better than your mobile phone on that side flap racing thing. Believe me on that. Buy a good intraoral camera.
Okay, thank you.
But
So
I
we
think you should come to me personally. You feel like in the next level. So I'm ready to help you. Any more questions? Quick.
Another question from Dr. Natasha. Is there a specific color cloth that you would advise to use as the background to take a snap of profile of a patient?
I always recommend very light color, something like this is Dr. Natasha's question. So
Yes.
your Dr. Natasha, I can see you in a video, your background at this point of time, a beige or something off-white, not very reflective is good enough. But the typical concept in dentistry, at least in India, is that green cloth and the blue cloth and all that. It's all gone. I suggest a plain off-white will be the best, at least for cosmetic and other, even orthodontic purposes. Dr. Reddy has said, thank you from South Africa. Appreciate profound. Thank you so much, Dr. Reddy. Looking forward to meet you in July in South Africa. Very happy to know that you are listening to this. Thank you so much. I know you're time-wise, you're not doing good in South Africa at this time-wise. So happy that you're still listening to this. Anybody else?
So just one more question. What should I do about fogging on the mirror? This question is asked by Dr. Abash.
Good question. I'm sorry that I didn't cover that in the area where I talked about the intraoral mirror. In the intraoral mirror, you have two options. Buy a 300, 700 rupee mirror, which I told you, or buy a 4,000 rupee anti-fogging mirror. Anti-fogging mirrors are very costly. I still use a normal 300, 700 rupee range steel mirror. Steel, yeah, not the real mirror. Steel mirror that won't break. Now, how to avoid fogging? You have to do a couple of things. One, I think the best thing you can do is ask your staff, stand next to you with that three-way air syringe ready there. Once you put it in, once you get the focus, everything ready, tell the staff to just put air and click. But when you do that chick, water should not come. That happens in many of the composite fillings and all that. In many of the old dental chairs, you can see water also coming in. That should not happen. It should be dry. Okay. So one, with that three-way, the air will solve the problem. But theoretically, to answer your question, other methodologies are: one, warm the mirror. Put the mirror in hot water. Warm the mirror. Not like boiling hot. Warm the mirror. And put that warm mirror in the patient's mouth. It won't fog as much. It's literally like your car. You're like, it's raining outside. You don't know what to do about this windshield getting fogged. Those who are driving might understand what I'm talking about. So it's just the temperature matching. So warm the mirror is another solution. Anything else?
So another question from Dr. Abash itself. How to get photograph of access opening during root canal treatment?
Access opening picture, you need a macro to a super macro lens. Super macro lenses are also available, but super macro lens, the problem is you open the, assuming this is the patient mouth opened and this is the lens, The super macro lens will have to come almost all the way in there up to the occlusal surface of the teeth, which is very, very difficult to focus. Super macro. In my photography lecture, I even demonstrate the super macro. Super macro, let me tell you, is ideal for all those rare kind of bugs and all that you see on your agricultural stuff. But for your root canal access treatment, good access opening picture, I think the answers are one, a nice intraoral camera will do better than your mobile will not work, period. Let's not talk about it. Digital SLR, it will work with 100 mm macro, it will work, but you need a nice mirror to reflect nicely and to focus correctly. You can get a pretty good access opening. One method, digital SLR with good mirrors, and the mirror having a magnification is also available. So you want to think about that, try that. There are mouth mirrors with magnifications, yeah. Then intraoral camera, I think, is much better deal here, because cost wise also is much easier. You can buy an intraoral camera. Or if you are talking about a professional, the lecture which I heard 3 days before in Kolkata for the 100th centenary celebration of dentistry in India, I was lucky to be a keynote speaker in Calcutta, and where I heard Dr. Gobi Krishna talking about root canals. My God, his pictures on the canal anatomy was amazing, but it was all taken with microscope. So we are talking about different level altogether. Then anything else?
So the last question for the night. Are the phone lenses that clip on the phone camera any good?
Any good? It helps you to zoom little more. It's not bad, but end of the day, the phone sensors are like maximum f-stop is so less. The aperture of a phone lens is like what? 2? I think the latest iPhone has like 2.2, 2.5. And the best f-stop or the best aperture for a DSLR, we're talking about 29. So mobile will never ever come near a real digital SLR. But depending upon what you want to do, I'm really surprised that all the questions I'm getting are actually those people who are really taking pictures. So I'm really happy. I'm really happy that people are asking these delicate questions. I never got these questions in our. I have done this lecture earlier in the same platform, but the questions were all, sir, where do I buy the cheek retractor and all that? But now the questions I am getting is on f-stop, which is amazing. So those who are interested in learning more, please get in touch with me. My numbers are, I think, there on the screen only. Come to me on personal WhatsApp. I will guide you, please. You don't have to come for my course. I'm not trying to advertise my program here. Just personally, let me know. I will help you guys on that. Ashok Raj says, actually, we need small aperture. So, Dr. Ashok Raj, again, I have to ask you, what do you mean by small aperture? Are we talking about small aperture value, or are you talking about the aperture size? That's it. I don't know. Others will get bored what I'm talking about here, because aperture F2 means a huge hole, and F29 means a small hole. So I don't know, Dr. Ashok Raj, how to explain that. Come to me personally. Let's not bore others. Yeah. Sure, Ashok. I saw your chat. Thank you so much. Anybody else? Anything else?
So I think we are done for the.
Great. Thank you so much. I'm so happy for the questions that came in. I'm really surprised and happy. And I assume that please come to me personally. In WhatsApp, I will guide you. You don't have to come to my course. I'm not trying to promote a course. Yeah. Please come to me personally. I will guide you. I already started getting personal messages. Okay. Go ahead. Are we done?
Yes, sir. I think we're closing for the session. Thank you all for coming up with interesting questions. So see you next month, second Wednesday, same time. Stay tuned.
Thank you. Thank you, whole technical team. And thank you, the whole batch, for joining in so early and being here completely till the end of the program. Thank you very much.